Hi everybody, this is the overview of my pocket guide for spring semester 2024. I started out with week 1 and I went over STIs and gastrointestinal disorders and hepatitis, which I thought would be, very key to know, especially in clinical setting. And then I kind of went over the pain and where the quadrants are, and what could be inducing the pain specific to where the organ is. Then I went over the specific different cholecystitis, appendicitis, ruptured aortic aneurysm, peptic ulcer disease. I kind of went through the basics of those and put that in here as a reference, as well as H. pylori ulcers, IBS, GERD, pancreatitis, diverticulitis, Crohn's disease, ulcerative colitis, and then I went through all the hepatitis, and I went through the antibodies and how to interpret positive antigens, as well as the antibodies in IgM and IgG, and I went over the different types of hepatitis to have, as well as the explanation of how the antibodies and antigens work for future reference. So then this is hepatitis C, and all that information, as well as D, and then we have labs, and then we went over STIs and STDs. So this is vaginitis, and how to treat, and then we went on to week 2 and common gynecological issues. So I provided updated information on suspected ruptured ovarian cysts and what an adnexal masses look like on a sonographic appearance based on up-to-date. And then I went over uterine fibroids to have as reference, and then provided this image for myself to know exactly where a fibroid would be in the clinical setting and what it would be defined as. Epidemiology, kind of the diagnosis and the basics of fibroids there. Then we went over fibroids in pregnancy, as this can be a possibility, and how these occur and why they occur. And then I covered endometriosis, which is very extensive. So this has the how to diagnose, differential diagnosis, types of endometriosis, the stages of endometriosis, how we treat endometriosis, and then the different treatment options. And then I provided a bunch of links for myself for clinical resources from up to date, so I can look at those for any patients that might have endometriosis, as well as specific education and clinical pearls that were offered during the seminar. And then I went over ovarian cysts, types of ovarian cysts. I provided this picture for myself, and how do we treat ovarian cysts, how they present, and then I moved on to adnexal masses, how they present, how we treat and diagnose. And then week 3 was HEAT. So I just put in the specific ones that I found were prevalent and that I was going to want to know about the clinical setting. So nurse, this is by no means extensive of everything we went over in that week, but keratitis, episcleritis, keratitis, iritis, uveitis, hyphema, hypopoion, surfer's eye, scleritis, conjunctivitis, something we'll probably often see. Clinical pearls, open angle glaucoma, cataracts, acute sinusitis, bacterial sinusitis, pharyngitis, education points. I didn't fill the allergic rhinitis in, but I did cover the otis media in this. Otis externa, sinusitis, and then we moved on to week 6 GYN oncology, provided myself with a diagram of where everything is, just so I have it as a reference. And then I covered uterine cancer, uterine sarcomas, presenting symptoms, how we diagnose, and more information based off the atypical endometrial cells, physical findings, risk factors, just how we diagnose is present, complex hyperplasia is what we're looking for, pre-malignant risk with atypia, and I went kind of a little bit more into CA125 as a marker. And then I went over stages of leiomyosarcomas in the grading. And then I moved on to endometrial cancer, presenting symptoms, how it is diagnosed, pap smear, endometrial biopsy, transvaginal ultrasound. Ovarian cancer I covered in here as well, risk factors, standard treatment plans, labs, referrals necessary, and I provided myself with some links, some more information on ovarian cancer. And then the staging of ovarian cancer, and then I covered the fallopian tube cancer and what you would look for, how you would diagnose it, education points, clinical pearls, and then more information in terms of cancer antigen 125 or ovarian and fallopian tube cancers. Let's see, more teaching provided on that, cervical cancer, and then I filled in more information about that. As well as colposcopies, biopsies, and LEEP procedures, standard treatment plans, links to routine standard treatment, and the ASCCP PAP guidelines. Vulvar cancer, I put this as needing to study for one of the exams, but just the signs and symptoms, how it's diagnosed, a standard treatment plan, and links that we might need to know. And then vaginal cancer, I provided in the information about this here, as well as risk factors for vaginal cancer. And then we moved on to week 7, which was infertility, and I provided myself in my pocket guide a lot of just standard information about infertility, what can be the medical causes for infertility, and what to look out for in terms of STIs. And then the conception rate, if basis 1 per week, 17%, 3 per week, 50%. It's kind of a good thing to be able to educate our patients on the amount of intercourse can lead to increased chances of conception, what sperm can cause infertility, as well as in terms of female infertility, what can be the causes of, and the basic workup necessary to work up a woman for infertility. And I found this very helpful, and being to have the labs outlined there, so I have those. More male infertility issues, and then we lead into week 8, which I had vulvovaginal disorders. I had vaginismus, vulvodynia, vulvar dermatitis, lichen sclerosis, lichen planus, lichen simplex chronicus, and then benign gynecological, I have dyspareunia, and then cervical polyps, adenomyosis, and then I moved on to week 11, which was breast cancer, and I did the overview of the different types of breast cancers, and prognostic and predictive factors that are associated with different types of breast cancer, and education necessary. HR receptive positive and HR2 negative cancers I provided in my pocket guide. Atypia and lobular carcinoma in situ, I included that as well. And then week 12, I included osteoporosis rheumatology, and then just a little snippet here for the syndromes, and then migraines, types of migraines that is going to be important to have in clinical and evaluation. And the acronym SNOOP10 I included here, as well as red flags for migraines. Clinical Pearls for migraines.